I think to summarize, Mr. Jackson was receiving very inappropriate therapy in the home setting, receiving very potent sedatives, including propofol, midazolam, and lorazepam, without appropriate monitoring, and by Dr. Murray, and ultimately this cocktail was a recipe for disaster in a patient that had underlying dehydration, and there was inappropriate access to the appropriate medical equipment, a delay in calling 911, and inappropriate resuscitation that ultimately culminated in his death. I think it was really a combination effect of particularly propofol, in addition mostly to the Ativan that he'd received in a patient who we had no baseline charting on. We didn't know what his status was. We didn't know if he was severely dehydrated. We didn't know if his blood pressure was low. We had no real basic vital signs on him. And I think this was the perfect storm that I described that ultimately culminated in his demise. In medicine, just as it is essential, we don't store things in our minds. I mean, we cannot take care of patients if we just say, oh, well, I knew this is what he told me or what she told me. We have to document things. And by documenting things, it's not just a tedious thing we have to do to keep records. It actually allows us to take better care of patients.
But the failure to chart was not a cause of death, was it?
The failure to chart was a contributing factor.
It's just an indication of what you consider bad medicine.
It clearly is bad medicine.